health and wellness world. We really want to explore like what it actually is. What does the science say about, what it could do for us? And, most importantly, what you need to know before you even think about trying it.
Yeah, definitely. There's a lot to uncover.
So to do this deep dive, we're going to be looking at a couple of really interesting articles. One is from NCBI Bookshelf. It's called Milk Thistle Stat Pearls.
Oh, yeah, that's a good one.
And then the other one is from Cam Cancer, and it's called Milk Thistle Silybum marianum. That one's got the fancy Latin name in there.
Gotta love the Latin names.
So we're going to uncover its history. How long has it been around? Look at what it might be able to do for our liver health, maybe even cancer care. And then, of course, we got to address those sometimes, too good to be true claims, right?
Yeah, for sure. It's a plant with a really interesting past and who knows, maybe some potential for the future of medicine.
Okay, so first things first. What is milk thistle? Like, if you were to picture this plant, what would you see?
Well, imagine like spiky leaves and like vibrant purple flowers.
Oh, okay.
You might even see it in your garden and think it's a weed.
Oh, really?
You wouldn't be totally wrong.
Oh, wow. Okay, so not necessarily something you would think, oh, it's going to be good for me.
But the part that we're really interested in is the seed.
Okay.
And specifically an extract from the seed called silymarin. And this is what researchers believe holds the key to all of all the possible benefits.
Silymarin. Okay, got it. So it's not just the milk thistle itself, it's that specific extract. Now, this isn't some new fad, right? Like, milk thistle has actually been used for, centuries.
Oh, yeah, over 2,000 years.
Wow. The Cam Cancer article mentioned that it was traditionally used for all sorts of things, like melancholy, headaches, even to help with lactation.
It's amazing how these ancient remedies sometimes lead to, modern day research.
Yeah, absolutely.
Today, scientists are really interested in silymarin's potential as an antioxidant, an anti-inflammatory agent, and even, maybe its anti-fibrotic properties. That could help prevent scar tissue.
That's really interesting. Let's talk about liver health, because that seems to be where a lot of the research is focused. The Stat Pearls article actually surprised me with the statistic that non-alcoholic fatty liver disease, NAFLD, it affects 20 to 30% of people in Western countries.
Wow, yeah, that's huge.
That's a lot of people.
It is. And unfortunately, there's no one-size-fits-all treatment. Lifestyle changes are usually the first line of defense.
Yeah, it makes sense.
But, researchers they're always looking for new possibilities.
Yeah, absolutely. So with no clear consensus on treatment, it sounds like they're really interested in what milk thistle could offer. So where does milk thistle fit into all of this?
That's where things get really interesting. A lot of studies suggest that silymarin might actually play a role in improving some aspects of NAFLD. Huh. For instance, there's research saying it could reduce insulin resistance and lower those fasting insulin levels. One study even showed patients taking 600 milligrams of silymarin every day for a whole year.
Wow.
Had significant improvement in their insulin levels.
That's promising, but I guess it makes you wonder if those effects can be sustained over the long term, right?
Yeah, you're right to be cautious. More research is definitely needed to, really understand the long-term effects and figure out the optimal dosages and all of that.
Okay, now let's address the elephant in the room. Cancer. We've all seen those headlines, right? Milk thistle, a miracle cancer cure. But what's the real story here? Is there any truth to those claims?
Okay, let's unpack this carefully. There have been some promising studies, lab studies, that show that silymarin can have anti-cancer effects, but this is in vitro, meaning in a controlled lab setting.
Right.
So silymarin, it's shown potential to, kind of mess with cancer cell growth and survival. It might even work together with chemo drugs to make them more effective.
Oh, so it could potentially make chemo work better. What would that actually mean for someone who's going through cancer treatment?
Well, we need to be careful here. These are very early findings. We need a lot more research, especially in humans, to know if these effects actually translate to real-world cancer treatment. We can't just jump to conclusions based on, what happens in a lab.
Yeah, so a bit of a cautionary tale there. But the Cam Cancer article did mention some potential benefits for people undergoing cancer treatment, something about reducing side effects.
Yeah, there's some evidence that milk thistle might be able to reduce the severity of certain side effects that come with cancer treatment. Things like radiation dermatitis and hand-foot syndrome.
Oh, I've heard those can be really rough. So any relief would be, very welcome. Can you tell us more about those side effects and like what the research says about how milk thistle could impact them?
Sure. So radiation dermatitis is basically it's skin inflammation from radiation therapy.
Right.
And it can range from, just mild redness to really severe blistering and pain.
Wow.
And then hand-foot syndrome, also called palmar-plantar erythrodysesthesia. That's a mouthful.
Yeah.
It's a side effect of some chemo drugs that can cause redness, swelling, and pain in, well, hands and feet.
Okay, so how does milk thistle supposedly help with all of this?
Well, for radiation dermatitis, the Cam Cancer article talked about 2 controlled trials that suggested milk thistle might be able to delay when the side effect starts and also slow down how fast it gets worse. So, imagine going through radiation therapy, but maybe experiencing less discomfort and healing faster. That would be huge.
Yeah, absolutely. And what about hand-foot syndrome?
Well, for that one, they mentioned a randomized trial that found topical Silymarin, so like applied to the skin, was the most effective at actually preventing that side effect compared to like 6 other things they tried. So if that's true, if topical Silymarin can really help prevent or at least reduce how bad hand-foot syndrome gets, that can make a huge difference in someone's quality of life during chemo.
Wow, that's pretty incredible.
It is, but again, we need more research to, confirm these findings and figure out the best way to use milk thistle to really manage those side effects. We're talking about, people's lives during a really tough time. So rigorous research is super important here.
Yeah, no, I hear you. Okay, so it sounds like milk thistle may have a supportive role to play in cancer care. Maybe not as a cure, but potentially as a way to, enhance those treatment outcomes and just make those tough side effects a little bit easier to deal with.
That's a good way to put it. It's not a magic bullet, but it's definitely an interesting natural remedy with, potentially a lot to offer, especially when it comes to supporting those conventional cancer treatments.
Absolutely. Now, I'm really curious about how milk thistle actually works in the body. I kind of like to imagine Silymarin as like these tiny warriors, right? Battling those harmful free radicals in the liver. It's like this, microscopic battle against oxidative stress.
I love that analogy. And you know what? It's surprisingly accurate. Remember those 3 key actions we talked about earlier? Antioxidant, anti-inflammatory, and antifibrotic? Well, each of those plays a really important role in how Silymarin works.
Okay, let's break it down a bit. Antioxidant, that seems pretty straightforward. Protecting cells from damage caused by free radicals, right?
Exactly. It's like Silymarin is giving your cells a shield, preventing those free radicals from causing all sorts of problems. And then there's the anti-inflammatory action. Now, inflammation's a natural process, but when it's chronic, like ongoing or out of control, it can contribute to a whole bunch of health issues. And Silymarin seems to have this, knack for dialing down that inflammatory response.
Okay. And then lastly, the antifibrotic action. This is all about preventing scar tissue. We touched on that with the liver, but I imagine that's important for other parts of the body too, right?
Absolutely. Scar tissue can build up anywhere in any organ or tissue, and it can really disrupt how things are supposed to work. So by inhibiting that scar tissue formation, Silymarin could potentially help protect a whole bunch of organs from long-term damage.
So it sounds like Silymarin has a pretty impressive resume, but let's get real about safety and side effects. Is this stuff actually safe to take?
Well, the good news is, at typical doses, milk thistle is generally considered safe and well tolerated. Most people don't have any major problems.
But of course, there's always a chance of some mild tummy troubles, right? I mean, we are talking about a plant here, so maybe a little bloating, an upset stomach.
Yeah, you're not wrong. Some people do experience a bit of that.
Okay.
But it's usually nothing too serious.
Well, I take a little bloating over, mushroom poisoning any day.
Oh, yeah.
The Stat Pearls article actually mentioned that in Europe, they use a purified form of psilocybin as an antidote for really nasty mushroom toxins. So that kind of highlights, the really potent protective power of milk thistle at a fundamental level.
Yeah, it's fascinating, how a natural substance can have such powerful effects. Yeah, it really is. But that brings us to an important point. Interactions. Milk thistle could potentially interact with certain medications, things like blood thinners or diabetes drugs. Okay, yeah, that's definitely something to take seriously. So bottom line, talk to your doctor before adding milk thistle to your routine, especially if you're already taking other medications or you have, any pre-existing conditions.
Couldn't agree more. All right, so we've covered a lot of ground here. I think it's safe to say that milk thistle is more than just like a prickly plant. It's got, this long history, some promising research, and a lot of potential.
Yeah, it does. And while it's not, a magic bullet, there's certainly enough evidence to warrant more research, especially when it comes to liver health.
Absolutely. Stay tuned because in part two, we're going to take an even deeper dive into the research on milk thistle and liver health. We'll break down specific studies, explore the nuances of the findings, and discuss what it all means for you.
We'll also tackle that controversial topic of milk thistle and cancer, separating fact from fiction.
We'll see you soon for part two.
Welcome back to our deep dive into milk thistle.
Last time we really explored its history, how it's been used traditionally, and, we got into the science behind some of its potential benefits.
Yeah, we uncovered some pretty interesting research, too, suggesting that milk thistle could have this special connection to liver health.
And that's exactly what we're going to unpack in more detail today, right? We're going to dig deeper into the studies on milk thistle and liver health, highlight those key findings, and explain what it all means for you guys listening.
So good.
As we learned earlier, non-alcoholic fatty liver disease, NAFD, it's a growing concern, and it affects a surprisingly large amount of people.
It really does, and unfortunately, there's still no, clear-cut treatment.
Exactly. So researchers are really looking at all sorts of avenues, including natural remedies like milk thistle. So let's dive into some of those studies. One of the findings that really stood out to me was the link between milk thistle and insulin resistance.
Yeah, that's a really crucial area of research. Insulin resistance it's like a key factor in how an NAFLD develops. When your body becomes resistant to insulin, it can't process glucose effectively. And that can lead to this buildup of fat in the liver.
So basically, insulin resistance is like this domino effect that can set the stage for liver problems down the road.
Yeah, that's a great way to put it. And that's where milk thistle comes in. Studies suggest that silymarin, that powerful extract we talked about, it may actually help improve insulin sensitivity.
The Stat Pearls article mentioned a study where patients taking 600 milligrams of silymarin every day for a year, they showed significant improvement in their fasting insulin levels.
Yeah, that's a pretty significant finding.
Yeah.
What it suggests is that a daily dose of milk thistle could really, significantly improve your body's response to insulin. And that's really crucial for preventing that fat buildup in the liver.
That's incredibly promising. What other insights have researchers, discovered?
Well, another important finding is that milk thistle seems to have a positive effect on liver enzymes.
And just to remind everyone, liver enzymes kind of act as these indicators of liver damage, right? So if those levels are high, it could be a sign that something's wrong.
Precisely. When your liver is damaged, it releases certain enzymes into the bloodstream. And, elevated levels of these enzymes can be a real red flag.
So what does milk thistle have to do with these enzymes then?
Well, several studies have actually shown that silymarin can lower the levels of certain liver enzymes, like AST and ALT. These are two of the most common markers of liver damage.
The Stat Pearls article even highlighted a study where silymarin was actually more effective at lowering those transaminase levels than some standard medications. That's pretty impressive.
It is, but it's important to remember that we still need more research to really confirm these findings and understand those long-term effects. But it definitely points to the potential of milk thistle as a supportive therapy for liver health.
Yeah, okay. I'm kind of seeing a trend here, lots of promising research, but we always need more to really solidify those findings. So for people who are struggling with MetFLD or who are just concerned about their liver health, this has to be encouraging, right?
It is. While, milk thistle shouldn't be seen as this replacement for conventional medical treatment, it could potentially be a valuable adjunctive therapy, something to, discuss with your doctor, of course.
Absolutely. Now, let's talk about that other big topic surrounding milk thistle cancer. We talked about those early lab studies that showed silymarin's potential anti-cancer effects, but we also, emphasized the need for more research, especially in humans.
Right. It's really crucial to be realistic and cautious about those claims of milk thistle being like a miracle cure for cancer. It's not.
But there might be something to that synergy we talked about, the idea that milk thistle could potentially make chemotherapy more effective.
Yeah, that's a really fascinating area of research. Some studies suggest that silymarin might actually make certain cancer cells more sensitive to chemotherapy, which could, potentially improve treatment outcomes.
So for someone who's going through chemo, the possibility of enhancing its effects, that's got to be a game changer.
It really could be. But again, it's important to remember that these findings are mainly from, lab settings. We really need more research, especially clinical trials with actual people, to confirm these effects.
So while there's hope, it's still early days in terms of understanding how this could be applied in real-world cancer treatment.
Exactly. We can't overstate the need for those well-designed human trials to validate these findings.
What about the potential for milk thistle to reduce, some of those side effects of cancer treatment? The CAM Cancer article highlighted some research on that.
Yeah, they specifically mentioned radiation dermatitis and hand-foot syndrome. Those can be really tough for people going through treatment. Radiation dermatitis, it's basically skin inflammation that's caused by radiation therapy. And it can be anything from, mild redness to really severe blistering and pain. And then hand-foot syndrome, which is also known as palmar plantar erythrodysesthesia. That's a mouthful.
Yeah, that is a mouthful.
It's a side effect of some chemo drugs. And it causes, redness, swelling, pain in the hands and feet.
So how does milk thistle factor into all of this? How could it possibly help?
Well, for radiation dermatitis, the CAM Cancer article actually cited 2 controlled clinical trials that suggested that milk thistle might delay the onset and slow down the progression of this side effect. So imagine going through radiation therapy and potentially experiencing less discomfort and having faster healing. That would be a significant benefit.
It would, absolutely. And what about hand-foot syndrome?
For that one, they mentioned a randomized trial that found that topical silymarin, so that's silymarin that's applied to the skin, was the most effective for preventing this side effect. And they compared it to like 6 other regimens. So if topical silymarin could really help prevent or even just reduce the severity of hand-foot syndrome, that could drastically improve quality of life during chemo.
Yeah, that would be incredible.
It would, but more research is needed to confirm these findings and really figure out the best ways to use milk thistle for managing these side effects. We're talking about potentially improving people's lives during a really, really difficult time, so rigorous research is absolutely essential.
Okay, so while we can't say for sure that milk thistle can prevent or treat these side effects, the initial research does suggest that it could have a positive impact.
Right. It's not a, guaranteed solution, but it's definitely a promising area to explore. But again, it's crucial to emphasize that anyone undergoing cancer treatment should always, always consult with their oncologist before adding any supplements to their regimen, and that includes milk thistle.
Safety first, always. It sounds like milk thistle might have the supportive role to play in cancer care, not as a cure, but potentially as a way to enhance treatment outcomes and reduce the burden of those difficult side effects.
That's a fair assessment. It's not a magic bullet, but it's a fascinating natural remedy with a lot of potential, especially in the context of supporting conventional cancer treatments.
We've really delved into some compelling research on milk thistle and its potential benefits for both liver health and cancer care. But it's important to remember that this is still a relatively new area of research.
Absolutely.
Yeah.
More studies are needed to fully understand, the mechanisms of action, optimal dosages, and those potential risks and benefits.
And it's not about just jumping on the latest, health trend. It's about making informed choices that align with your individual health needs and goals. And of course, consulting with your doctor before making any decisions.
Exactly. Milk thistle is not a cure-all. It's a potential tool in your wellness toolbox, but it's essential to use it wisely and with the guidance of a healthcare professional.
So where do we go from here? What are some key takeaways for our listeners as we kind of move into the final part of our deep dive?
I think the biggest takeaway is that milk thistle has shown real promise in both preclinical and clinical studies, particularly for its potential to support liver health and manage those certain side effects of cancer treatment.
And we've learned that it's not just some, random plant. It has a long and rich history in traditional medicine going back centuries.
That's right. But it's also crucial to remember that more research is needed, and anyone considering using milk thistle should always talk to their doctor first, especially if they're taking other medications or have any pre-existing health conditions.
It's all about being informed and making those choices in consultation with your healthcare provider.
Exactly. Knowledge is power when it comes to your health.
Okay, so we've covered a lot of ground today, but we still have one more intriguing aspect of milk thistle to explore, and that's, its safety profile, potential side effects, and things to consider before adding it to your routine.
And that's precisely what we'll be diving into in part 3 of our milk thistle deep dive. We'll explore those potential side effects, drug interactions, and, things you should be aware of before considering milk thistle.
Stay tuned for the final part of our deep dive, where we wrap up our exploration of milk thistle and hopefully equip you with the knowledge you need to make those informed decisions about your health. Welcome back to the deep dive.
So in this final part of our exploration of milk thistle, we're going to shift our focus to, its safety profile.
Hmm?
Like, what are some of the potential side effects and what are the things you really need to consider before you even think about adding this supplement to your routine?
Yeah, it's all about being informed and really making those choices, for your own health. And part of that is understanding both the good and the bad, the risks and the benefits.
Absolutely. So let's start with the good news. Both of the articles we've been looking at, the Stat Pearls article and that cancer overview, they seem to agree that milk thistle, at least in typical doses, is generally considered safe and pretty well tolerated.
That's right. Most people, they don't experience any significant side effects. But of course, we had to do our due diligence, right? We dug a little deeper. And it turns out there are a few minor side effects that some people might experience. The Stat Pearls article mentions things like gastrointestinal upset, diarrhea, headache, bloating, and even some skin stuff like hives or a rash.
Yeah, those are all possibilities.
Yeah.
But it's important to remember that these side effects are usually pretty mild, and they tend to be, temporary.
And hey, it's still better than dealing with, a nasty mushroom toxin,
Yeah.
right? Remember we talked about how in Europe they actually use a purified form of psilocybin as an antidote for mushroom poisoning?
Right, right. It's a pretty amazing example of just how, potent this plant can be.
Yeah, it is. But speaking of, potentially serious issues, we got to talk about interactions, right? Milk thistle could actually affect how certain medications work in the body.
Exactly. And that's where things can get a little bit complicated.
Yeah.
The Stat Pearls article, they specifically mentioned that milk thistle could interact with blood thinners and diabetes drugs.
Okay, so what does that actually mean?
Well, it means that it could potentially increase the risk of bleeding if you're taking blood thinners, or it could make it harder to control your blood sugar if you're on medication for diabetes.
Got it. Okay, so this is why it's super important to talk to your doctor before you start taking milk thistle, especially if you're already on other medications or you have any, pre-existing health conditions. This is not a DIY kind of thing.
I completely agree. It's always best to err on the side of caution and get that professional guidance.
Absolutely. So let's recap those key takeaways here, because this is really important. First and foremost, while milk thistle is generally considered safe at typical doses, it's not completely without risk.
Right. It's important to remember that, this is a plant. It's not a magic potion. And with any plant, there's always a chance of some mild side effects, especially those that affect your digestion. And then, of course, those interactions with medications, those are a real concern. So talking to your doctor before you add milk thistle to your routine is absolutely essential.
Couldn't agree more. And one last thing I wanted to touch on, both the Stat Pearls article and that cancer overview, they mentioned that there's very limited research on using milk thistle during pregnancy and breastfeeding.
Yeah. So until we have more information, it's generally recommended to, just avoid it during those times.
Yeah, better safe than sorry. Excellent point.
Yeah.
Okay, so we've really thoroughly explored milk thistle, its history, its potential benefits, all those promising areas of research, and of course the safety considerations. We've really covered it all.
We have. And while it's definitely not a cure-all, it's a really fascinating natural remedy with, a lot of potential, especially when it comes to liver health.
It really is. But as with any supplement, it's about being informed, making those choices in consultation with your healthcare provider, and just, listening to your own body.
Well said. It's about, being an active participant in your health and your well-being.
That wraps up our deep dive into the world of milk thistle.